Hey guys, so today we're going to be talking about cold medication. The first thing I want to get across is that cold medication does not cure you. It's not going to get rid of your cold. What it's going to do is it's going to make your symptoms manageable enough for you to get through your day and allow your immune system to get rid of the infection. To support your immune system during this time, you want to make sure you're getting adequate nutrition, you're staying hydrated, and you're getting as much rest as possible. So once you have supported your immune system, obviously you can't just drink water and lay in bed for 3 days until your cold is gone. You have to go to work most of the time, so you're gonna take some sort of cold product. There is an entire aisle at each drugstore just full of cold products. The most common one I would say is Dayquil. There's also Theraflu brand and Alka-Seltzer brand. All those three I just listed, the cold and flu version of those drugs have identical ingredients. They have acetaminophen, they have phenylephrine, and they have dextromethorphan. Those are great if you have a sore throat or headache, you have a stuffy nose, and you have a cough. That'll cover that, no problem. But I don't usually recommend them, and I'll tell you why. First is they're pretty expensive. One box is $10, and that gives you about 3 days of treatment. And in any given cold, you may or may not have those symptoms. Why would you want to take a drug if you do not have the symptoms that drug is going to treat? You're just taking medication and wasting it. Another reason as to why I recommend the targeted treatment or individual drugs versus the combination products is because your symptoms usually peak at different points of the day. You may have a stuffy nose in the morning and a runny nose in the evening. So starting with cough. The only medication over the counter that can treat a cough is dextromethorphan. That is in Delsum. You'll also see products like Mucinex DM or Robitussin DM. You can buy those if you'd like. I personally think that Robitussin and Mucinex, the active ingredient in those is guaifenesin. Guaifenesin is labeled as an expectorant, and when you look at the studies of guaifenesin, taking guaifenesin versus just drinking a full glass of water thins out your mucus to the same degree. So it's essentially no better than placebo. So I don't recommend it because the studies don't really back up the claims that they make. Also, if you are taking, let's say, Mucinex DM, which has guaifenesin, which is meant to thin out your mucus so you can cough it out, and it has dextromethorphan, which is a cough suppressant, why would you want to thin out mucus to make it easier to cough out and then suppress that cough? They're completely contradictory drugs. So Mucinex DM, Robitussin DM, I never ever recommend those. Now if you have a sore throat, a headache, body aches, fever, I will recommend Tylenol. It interacts with the fewest amount of drugs versus an ibuprofen or an NSAID. So you can buy a bottle of Tylenol 500 count for like $5. Also with the cough, if you have a dry cough, I would recommend taking dextromethorphan. If you have a wet cough, as irritating as it may be, it's better to cough that out if you can, because you don't want that mucus sitting down in your lungs. Now if you have a stuffy nose, phenylephrine or over-the-counter brand Sudafed is the best thing to open up your stuffy nose. If you have a runny nose, that is different. You want an antihistamine. Now antihistamines are the same things that treat allergies, just seasonal allergies. What they do is they pretty much turn off the faucet and dry up all that drippiness. So postnasal drip, runny nose, things like that, you would take an antihistamine. I usually recommend loratadine, that's generic Claritin. That's the cheapest and for the most bang for your buck. If you want one at bedtime where you're having a lot of postnasal drip and runny nose at bedtime, I recommend diphenhydramine or Benadryl because it'll help you sleep, it makes you really tired, and it's a very strong antihistamine. Another benefit of taking Benadryl at night that most people aren't aware of is it does have a slight effect on coughing. It can suppress your cough to a degree. Most people don't take it throughout the day though because of the drowsiness that it causes. Now if you have congestion of the sinuses, you feel like your head is underwater or your ears are plugged, you would go to the pharmacy counter and ask for pseudoephedrine. Now pseudoephedrine is first made by Sudafed, but it's not the same as a Sudafed over the counter. The one that's in the aisle, phenylephrine, is just for your nose. The one that's behind the pharmacy counter is for your sinuses and just overall head congestion. So there's a differentiation between that. I try to always recommend the active ingredient or the generic name, because if you say brand name, you say Sudafed, well, Sudafed makes a lot of products. So you want to make sure you're looking for specific ingredients and not just the name of the company, because a company name does not necessarily mean there's only that drug in that product. So to recap, I don't like recommending combination products because you may not have all the symptoms that they're treating. They're expensive, and usually your symptoms are going to peak at different points of the day. For your cough, you want to look for drugs with dextromethorphan in them. For your stuffy nose, you want to get phenylephrine. For any sort of pain or fever, Tylenol or acetaminophen is the best thing. Now, if that one doesn't seem to work for you, you can always try ibuprofen. Just be aware it is a blood thinner, so if you take other medication, it's always good to double check with your pharmacist before taking any over-the-counter product. And for that runny nose or postnasal drip, any type of antihistamine will dry that right up. I hope this helped, guys. See ya.